In this video, we will discuss Uttar Pradesh Veterinary Medical Officer examination paper, which was conducted in the year of 2022. There are totally 80 questions were asked in this question paper. We will see one by one. The first question which is asked is common extender used for frozen semen. For frozen semen, usually it is commonly to use any extender which contain tris-based buffers. So the correct answer for this question is tris buffer diluent. In any extenders, there are few components are there. So they are namely one is buffer, and other component of the any common extenders are cryo protectant, and then energy source and membrane stabilizers, and in the last antibiotics. So we will discuss the components of tris egg yolk glycerolated extender. So the buffer used is tris. So this is the common name for hydroxymethyl aminomethane. So this is the buffer which is used in the extender. Then as cryoprotectant, glycerol is commonly used. As a source of energy, glucose, fructose are often used. And then membrane stabilizers such as egg yolk or sometimes soybean lecithin are also used. So actually this egg yolk will protect the plasma membrane of the sperm. Then in the end, antibiotics are also used to counter the unwanted bacterial growth in the extender. So this is the first question. So this is how we will proceed with this question paper. We not only just answer the question, but also I will discuss the reasoning and also evaluate other options which were there in the question paper. And in the next, a cow suffering with milk fever having a body temperature. This milk fever is a misnomer. So in the milk fever disease, there is no fever at all. So actually in milk fever, there is, in second stage of the milk fever, a subnormal temperature is noticed. So the answer is 98 degrees Fahrenheit. Now, which of the following is at top of Edgar Dale's cone of experience? Edgar Dale, he was the scientist who gave this cone of experience. He positioned these activities which provide effective learning experience for the learner. So those activities which are very high efficient in learning, they were positioned at the basic level, and then those activities which are not usually have high efficient in terms of learning, and there is limited learning will occur. So such type of activities he positioned those at the top of the cone. So among these four options, you have to select which of the option has limited efficient learning will be taking place with the help of this option available. So if you see, the option B is field trips. So in first, hands-on training will be occurring in the field trips, and this is the best way to learn anything. So this will be positioned at the base level, and then exhibition is positioned just above the field trips. And then when it comes to visual and verbal, so one can learn more efficiently when somebody uses visual symbols. So above the exhibition, we will position the visual symbols. Then at top of this Edgar Dale's cone of experience, we will position this verbal symbols. So the correct answer for this question is verbal symbols. So in the next question, how much layer ration is required to produce 1 kg of eggs? So that is to produce 12 eggs. A layer ration required is 2 kg. And in the next question, a brooder pneumonia in chicks is caused by, the options were filtrable virus, Haemophilus gallinarum, Aspergillus fumigatus, and none of the above. This Haemophilus gallinarum causes infectious coryza. So the correct answer for this brooder pneumonia is Aspergillus fumigatus. So the word brooder, which stands for the young chicks. So therefore, this disease is called brooder pneumonia, which has the impact on respiratory system of the bird. So which is caused by the fungus, that is Aspergillus fumigatus. So in the next question, this persistent corpus luteum may lead to anistrus, abortion, hemophilia, and none of the above. This hemophilia is not at all related to the corpus luteum. And in abortion and anistrus, whenever we discuss about corpus luteum, this corpus luteum will produce a very common hormone, that is progesterone, which is commonly denoted as P4. So the function of this progesterone is to protect pregnancy if it is pregnant. So therefore, this abortion option is cancelled out. And in non-pregnant animals, this progesterone has a negative effect on GnRH hormone, which is secreted by hypothalamus. So if there is no GnRH secreted in presence of progesterone, which is secreted by the corpus luteum, so there won't be any secretion of LH and FSH from the pituitary. If there is no LH and FSH, animal won't come in the estrus and it won't ovulate. So therefore, this persistent corpus luteum leads to anistrus. So the correct answer for this question is anistrus, that is option E. Now the drug of choice for the treatment of bovine tropical filariasis. So the correct answer for this is bupivacaine, and whereas this berynyl is used for treating babesiosis. So this is very tricky question. According to the Preservation of Food Adulteration Rules, 1976, which of the following is correctly matched? So here you can notice the class of milks are pasteurized buffalo milk, raw cow milk, and toned milk, and then standardized milk. As we all know, the fat percentage and SNF percentage of standardized milk is 4.5 and 8.5 respectively. So the correct answer for this question is option D, that is standardized milk has 4.5% of fat and 8.5% of SNF. When it comes to other options, this toned milk, if you look at this fat percentage, that is 3%. This is actually correct. But in the SNF percentage, the SNF percentage of toned milk is 8.5%. And then one can also have to remember the fat percentage of double toned milk is 1.5%. And this pasteurized buffalo milk, actually this fat percentage is very high. The fat percentage for this is 5, and for cow it is 3.5. Therefore, these two above options are not correct. And for this toned milk, the SNF percentage is actually 8.5. Therefore, this is also not correct. So the correct answer for this question is standardized milk. Now, let us match the following: saliva and their pH range. Saliva 6.7 to 6.9. This is correct. The mucus of crop has a pH of 4.7 to 4.9. This is also correct. The gizzard content is little bit more acidic in nature. That is 2 to 3.6. And when it comes to gastric juice, so here they have given 4 to 4.4. But some other literatures were also suggested it is ranges between 1.5 to 3.5. So let us keep this question aside. Then we'll continue. The 10th question says, length of cervix in cow and buffalo is 5 to 10 cm. This COFAL test used for the diagnosis of which of the disease? If you know this expansion of this COFAL actually stands for complement fixation for avian leukosis complex. So the correct answer for this disease is avian leukosis complex. So this disease is also called as big liver disease. So which has another synonym as lymphoid leukosis. So the other options were given as Rannicke disease. So this Rannicke disease is also called as Newcastle disease, and there are different types of virulent based on their virulence factor. This disease has classified as velogenic and mesogenic, lentogenic, and at last asymptomatic. And velogenic, again it is classified as velogenic viscerotropic and velogenic neurotropic. So this is very important disease, the Rannicke disease. And Gumboro disease, this is another name for IBD, that is infectious bursal disease. So this is about this question. The COFAL test is used for the diagnosis of avian leukosis complex. Now in this next question, the following organ or tissue sample should be sent to the laboratory in suspected copper poisoning is liver. So many times this question has been asked. Now which of the following approach does not help in control of antibiotic resistance? So we should have to select such option which won't help in controlling antibiotic resistance in the animals. The option A says antimicrobial sensitivity test is necessary to select the drug therapy. So this is actually true. Before going to select the antibiotics, one must practice the antibiotic sensitivity test. And then option 2 says drug combination may overcome the emergence of drug resistance. Yeah. So multiple combination of drugs can also be used to overcome the resistance to the antibiotics. And then the option 3 says drug should not be used for short period of therapeutic. And option D says isolation of sick animals as a preventive measure to spread of resistant bacteria. So this is also correct practice to control antibiotic resistance. If you carefully see the option 3, which says drug should not be used for short period of therapeutic uses. So here, when it comes to antibiotic resistance, it is a well-known fact, and it is noticed that if prolonged usage of a particular drug will lead to a resistance from the bacteria which were there in the animal. So therefore, option 3 is not a suitable approach or a practice to control antibiotic resistance. So question 14 says, which of the following are applied on vulva to retain the prolapsed vagina? So the answer for this question is a modified quill suture. So this suture is used to in case of prolapsed vagina. Now here we match the following question: Lucia cavalli, Gibsoni, Sproutmani, and then Motasi. So this cavalli is responsible for the babesiosis in horse, whereas this Gibsoni is in dogs, and then Motasi in sheep, and this Sproutmani pigs. Now we'll look at question 16. Here also match the following question: they are father of anatomy, veterinary medicine, histology, and immunology. The father of anatomy is Claudius Galen, and then father of veterinary medicine is Renatus Vegetius, and then father of histology is Mary Francois, and then Xavier Bichat, and the father of immunology is Edward Jenner. So here this question is a little bit tricky, and it is more factual. So, and then question 17 says feed ingredient responsible for yolk coloration in the layers diet. So which feed is responsible for the coloration of the yolk? So the answer for this question is yellow maize grain. So these grains which are there in yellow color are responsible for the coloration of the yolk. So here also the following question is there. So the instruments and their names. Regarding a commonly used breed instrument, which one of the following is correctly matched? So actually we will match all these instruments. So lychee is teat tumor extractor, and this hugs is teat knife. This Larson's is teat tube, and there is Hudson's teat spirals instruments are available. So this is also a tricky question. So now this 19th question says start anticonvulsant dose of phenobarbital in dog is 2 to 4 mg per kg body weight, which is given orally. This question says Vanaraza is dual purpose variety of chicken, which is developed by this Vanaraza is developed by ICAR PDR Hyderabad. So this is Directorate of Poultry Research, which is located in Hyderabad. So this institute has developed this Vanaraja. This is a dual purpose variety of chicken. Now the question number 21, which says placenta is considered retained in the cattle if it is not expelled within 7 to 8 hours, 1 to 4 hours, 24 hours, and then 4 to 12 hours. The correct answer for this question is 8 to 12 hours. This is a very important question. This is under Rashtriya Group. A farmer maintain the best herd of indigenous breeds and practicing best management is awarded with Kamadhenu Award, Gopal Ratna Award, Pashudan Award, Kisan Samman Award. So this Rashtriya Gopal mission, which was started in 2014, and under this usually commonly they give 2 awards, and those were one is Kamadhenu Award and Gopal Ratna Award. This Kamadhenu Award is given for such trusts and organizations or any groups so which maintain indigenous breeds and practice the best managemental practices. So this Kamadhenu Award is for the trust, organizations or groups, not for any individual, a technician or farmer. But whereas when it comes to the Gopal Ratna Award, which is usually awarded for a farmer or a technician or any dairy or milk producing farmers organizations. So as the correct answer for this question is, so here they are asking under the Rashtriya Gokul mission, a farmer who maintain the best herd of indigenous breeds and practice. So the correct answer for this question is Gopal Ratna Award. So along with the farmer, this medal can also be given for the technician who is best AI technician, and also such dairy or milk producing farmers organizations are there, they can also be awarded with this award. So we'll look at the next question, that is question number 23. Inni the cross up. This is very easy question, genet and stallion. And then the bacterial count of good quality raw milk should be. There are actually 4 types of quality of the raw milk is classified based on their bacterial count. So this is standard plate count. Here they are classified as very good, good, fair, and poor. So they are asking good quality. In very good quality, the bacterial count should not exceed 2 lakhs. And in good quality, the bacterial count should be between 2 to 10 lakh. And then in fair quality of milk, the bacterial counts are between 10 to 50 lakh. And if more than 50 lakh, then that milk will fall under the poor quality. So this for this question, the answer for this good quality raw milk should not exceed. So that is very good quality milk. So for good quality milk, it is between 2 to 10 lakh. Now this question 25 says, consider the following event, arrange them in chronological order based on their year of implementation. This transport of animal rules, so which were notified in 1978, and then performing animal rules were notified and they were released in 1973, and this prevention of cruelty to animal act, which is a very well known act, which is in 1960, and then animal birth control dog rules. First these are notified in 21, that is 2001, and recently they are also again amended in the year of 2023. So here this very important thing is that one can also ask what is performing animals under this rule. So this rule define what is performing animals. So those animals which are used for entertainment purpose and public are allowed through the sale of tickets. So for such animals they refer performing animals. And one should at least remember this Prevention of Cruelty and Cruelty to Animal Act. This was passed in the year of 1960. So many times this question has asked. Now question 26 says, central permanent pair of incisors appear in cattle. So this is very important. Remember this is cattle at the age of. They are asking central permanent pair. So these are incisors. So this is the central permanent pair. So they usually appear at the age of 2 years. So that is answer 24 years. And one can also ask by which year the second pair of incisors will develop. So for second pair of incisors, the answer is 3 years. By the end of 3 years, the second pair of incisors will develop, and at the age of 2 years, the first pair of permanent incisors will appear. And then by 4 to 5 years, animal will become full mouth. So this is for cattle. So you have to just add 1 year extra for buffalo. So that is 4 to 6 years it takes for buffalo to get full mouth. So this is the question 26. Now we'll see, this is 27. Disease which affect single animal and show no tendency to spread within the herd is. These options are exotic disease, sporadic, angiotic, and epizootic. This angiotic is also called as endemic, and epizootic is also called as epidemic. So here this question says no tendency to spread within herd. So therefore the correct answer for this disease is sporadic. So sporadic diseases are those diseases which have very little to no tendency to spread. So answer is sporadic. And this exotic diseases are those diseases which not commonly there present in the any particular region or country. So usually they come from under foreign region or foreign country. So such diseases are called as exotic disease. And this exotic disease is the disease which is always present in the population but in small numbers. Whereas this epizootic disease, the word epi itself indicate the disease frequency is very highly present in the population and which target very large number of the human or any animal population. Then another word is that is pandemic. This pandemic is sudden spike in the disease in the population and which spread across the continents. So the geographical area which control is very huge. So that is pandemic. Now the question 28 says a feed stuff classified as roughage. For roughage, there should be more than 18% crude fiber should be there. That is, here this is more than 3% ether extract, so this is not at all related. Less than 16% crude protein, less than 3% lignin, and more than 18% crude fiber. So the correct answer for this question is more than 18% crude fiber. So that is classified as roughages. And for those feed stuff which has less than 18% crude fiber are called as concentrates. Now the dry matter intake of dairy cattle or dairy animal should be 1% of the body weight per day, 0.5, 4, 10. So the correct answer for this question is 4% of body weight per day. The range for this dry matter intake in dairy animals is between 2.5 to 3.5%. So this 4% is commonly used in high producing animals. This question number 30 says, in which animals serous cord is seen as a complication of castration? So this is a very easy question asked many times. That is, the answer is horse. Now, mating of unrelated individual within same pure breed is. So here they are asking mating of unrelated individuals within a breed. So that is the options as inbreeding, outbreeding, outcrossing, and crossbreeding. So the correct answer for this question is outcrossing. So this crossbreeding is between two breeds. The crossbreed is between the two breeds. And in case of outcrossing is within the breed only, but those two animals or individuals are unrelated. Unrelated. In inbreeding, so these animals are within the breed and they are closely related. Now this question 32 says hog cholera is caused by filtrable virus, Clostridium chaui, Haemonchus contatus, and none of the above. Clostridium chaui is not, Haemonchus contatus is also not. This is the filtrable virus. The hog cholera is the viral disease. Now the question 33 says Mali is a pig breed which has its habitat in. This is usually seen in Tripura. So such type of questions are asked. So it is very difficult for one to remember all these breeds. So nothing can be done. Then metabolic active form of vitamin D is ergocalciferol, 25 hydroxy cholecalciferol, then cholecalciferol, then 1,25 hydroxy cholecalciferol. So the answer for this question is that is option A, 1,25 dihydroxy cholecalciferol. Now question 35 says bestiality is punishable under which section of IPC? Section 93, section 377, 415 and 429. So this is a very well known section, that is section 377. Actually Supreme Court in the year 2018, the case of Navtej Singh Johar. So in this case Supreme Court held that it decriminalized consensual same sexual relations. But so such type of decriminalization is not applied for non-consensual sexual acts and bestiality. So the means is to say this bestiality is punishable under IPC section 377. So actually this 377 says as criminalize carnal intercourse that is against the order of the nature. So such type of sexual acts are classified or considered as criminal activity under the section 377. And the section 93 says communication made in good faith, and the section 415 is related with the cheating, and the section 429 is actually it criminalizes mischief by killing or poisoning or maiming, that is rendering animal useless. So that is section 429 which criminalize the maiming and poisoning and any other mischief. So the next question 36 says most common maternal cause of dystocia in buffalo. So this is maternal cause. So there are actually two types of causes are there, maternal cause and the fetal cause. So the option says lateral deviation of head and neck. So this is actually a fetal cause, and then a breech presentation is also fetal cause. Torsion of the uterus. So see, this uterus is of the organ of the mother. So therefore, this is the maternal cause. Then swollen face and spinky eyes is a symptom of coccidiosis, aspergillosis, Marek's disease, and infectious coryza. So the correct answer for this question is infectious coryza. Now the question 38 says chemicals used as preservatives in developing solution. So the question says, what is the chemical which is used as preservative in developing solution? In the processing of X-ray, there are actually 3 to 4 solutions are there in producing and processing X-ray. So we'll see them first, then we'll answer this question later. So the first step is developing. So in developing, the components or the chemicals used are reducing agent. So that is hydroxyquinone. So this hydroxyquinone will reduce ionic silver to metallic silver. So this is the function of this reducing agent which is there in developing solution. And the next component of the developing solution is preservative. So commonly used preservative is sodium sulfide. And then restrainer. The restrainer is potassium bromide. And the fourth component of this developing solution is activator. So that is sodium carbonate. So for developing solution, the preservative agent is sodium sulfide. So therefore, the correct answer for this question is sodium sulfide. So you have to remember all these things. Many times these questions have been asked. And then after developing solution, then there will be rinsing for 10 to 30 seconds. Actually, this developing solution, which takes time up to 5 minutes in 20 degrees Celsius, and then again it goes to rinsing for 10 to 30 seconds, and then a fixer is there where the fixing will be done, and that is for 10 minutes. And there are other components of the fixing agents, such as one is fixing agent, that is sodium thiosulfate or ammonium thiosulfate. Then the other component is acidifier. So that commonly used acidifier is acetic acid, and then the hardener is there in the fixing solution, that is ammonium chloride. And then in the end there is washing with the normal water. So this is about the question 38. And then next question is, we'll finish up to 40 question. The first line of defense of livestock against the thermal stress is increased respiratory activity, activation of sweating, and then making changes in the circulation, making behavioral adjustment. The correct, more appropriate answer for this question is there is a change in the circulation. So therefore, we try to adjust the thermal stress to the animal. So the correct answer is C. And then question 40 says, depreciation of Pakka cattle shed per year should be. So the depreciation rate for a Pakka cattle shed is, that is 2%. So remaining question we'll discuss in next video. So this discussion is very important for somebody who is preparing for the UPSC Senior Veterinary Officer for Andaman and Nicobar, or some state PPS such as Karnataka State, Punjab, Rajasthan, Haryana, even J&K and UP. So you can refer these videos. So these are very helpful. So we'll next video we'll discuss from question number 40, question number 41. Thank you.